This patient came to see me almost a year ago for consultation regarding tooth number 2. According to the patient, at the time when I saw him first about a year ago, he was complaining of some achiness that would come and go, and then some temperature sensitivity and some pain to biting on tooth number 2. As you can see, there's a PFM crown on the tooth, crown a few years old. So I examined the tooth, evaluated the tooth, and determined that the tooth was going through irreversible pulpitis with acute apical periodontitis and recommended endodontic treatment. Patient declined. He said, I can live with this. The tooth doesn't bother me. I want to wait on the root canal. Sure, I said. Well, as you can see, here is the date when I first saw him about a year ago. Then he came back March 14th of this year, and you can see, so about 2 months ago, about a little less than 2 months ago, again regarding tooth number 2. And now he said his symptoms had changed. Now the tooth was achy more and there was no temperature sensitivity. And lo and behold, take a look. That's why multiple angulation PAs are important. This x-ray you may not see much. Could be something here. And then you take one more angulation and now look what happened here. Look, the large periapical lucency associated with the palatal root. So this tooth went through necrosis, pulp necrosed, and now patient has an abscess. So a few months ago, when I saw him, this tooth had a much better prognosis because it was the pulp was still vital, there was no infection, irreversible pulpitis, and the success rate was much higher. Now the success rate for this root canal is lower because now we're dealing with bacteria and a chronic infection there with symptoms. So talked to patient about all of that, and patient said that he wanted to go ahead with the root canal now. And he's scheduled 2 months later. So 2 months later, again, he came back and we took another couple of x-rays just to see how things are looking. And as you can see, that periapical lucency is still there, maybe a little bit larger also. So today went ahead and started and completed the endodontic treatment in one appointment, went through the PFM crown, and take a look. As you can see, everything went beautifully. That's the MB canal. Look at that deep split in the apical area of the MB canal. Distal buccal and palatal, you can see that large periapical lucency there. There was no MB2 I trough or an MB2. However, I saw a fin, a groove along the MB canal that I was able to three-dimensionally instrument, irrigate, and obturate. And again, you can see that beautiful split in the apical area. Everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration.